Hello friends, welcome to the channel all about the human body and health. In this video you will learn about diabetes, what are the causes and many others. Don't forget to subscribe and rate the video. What is diabetes? Diabetes is a chronic non-communicable disease that occurs when the pancreas can no longer produce insulin, or does not produce it at all, or when the body can no longer use insulin properly. Insulin is a hormone produced by the pancreas, which acts as a key that allows glucose from ingested food to pass from the bloodstream into the body's cells to produce energy. In the blood, all carbohydrates from food are transformed into glucose. Insulin helps glucose enter the cells. There are two types of diabetes: type 1 diabetes, previously known as insulin-dependent, juvenile or childhood-onset diabetes, is characterized by absolute insulin deficiency and requires daily insulin administration. Although type 1 diabetes is mainly diagnosed in childhood, it can appear at any age. Type 1 diabetes cannot be prevented because it is caused by an autoimmune process in which the patient's immune system attacks the pancreatic beta cells, i.e., the cells that produce the necessary insulin. Type 2 diabetes, previously known as non-insulin dependent or adult onset, accounts for at least 90% of all diabetes cases. Unlike type 1 diabetes, which cannot be prevented, type 2 diabetes, according to several studies in the field, can be prevented or delayed. It is characterized by insulin resistance and relative insulin deficiency, present together or separately at the time of diabetes diagnosis. Type 2 diabetes can be diagnosed at any age. Type 2 diabetes can remain undiagnosed for many years, and the diagnosis is often made when a complication occurs or as a result of routine blood or urine glucose testing. It is often, but not always, associated with increased body weight or obesity, which in itself can lead to insulin resistance and increased blood glucose levels. Prediabetes is a term used to describe the medical condition of patients who show alterations in glucose tolerance. In their situation, the blood glucose level has values above the recommended ones, but they are not so high that the diagnosis of diabetes can be made. Prediabetes is silent, in the sense that there are no worrisome symptoms that could send a patient to a medical consultation. Gestational diabetes occurs exclusively during pregnancy in women who did not have diabetes before the pregnancy period. Gestational diabetes requires treatment in order to reduce and control the associated risks both during pregnancy and at birth: spontaneous abortion, premature birth, macrosomic fetus, breathing difficulties of the newborn, risk of obesity and risk of developing type 2 diabetes too at the age of maturity.